Hi, everyone. I'm Amy. I work for the Eating Disorder Center of Montana, and then Brooke is here with us. She is one of our registered dietitians at EDCMT. The Eating Disorder Center of Montana has been treating eating disorders in Bozeman since 2013, so for 10 years now. And then we also opened a second location in Missoula recently. And we have the highest level of eating disorder treatment that's available in the state of Montana. I think we'll go into a little bit about the different levels of care that we offer in the presentation. But in addition to treating eating disorders, something that we're really passionate about is sharing education and talking about these things that we deal with every day, all of us, even if we don't have an eating disorder, such as weight stigma or diet culture, things like that. So we're very excited to be here and talk about some of these issues with you. And I think we will have some time for questions at the end. I don't know if that's, so if anyone wants to drop questions in the chat box, I think we could do that. So we know that eating disorders are a big mental health issue. 1 in 5 Montana adults will struggle with an eating disorder, will struggle with a mental illness, and eating disorders are one of those mental illnesses. What is an eating disorder? We know that a lot of people don't think about eating disorders as a mental illness, but they are. Eating disorders are a complex mental health disorder that affects how a person feels about body, weight, their shape, size. It can affect how they feel about food or eating or nutrition, can affect their physical activity, and it can affect their self-worth and self-esteem. So in the US, over 9% of Americans will have an eating disorder during their lifetime. 31% of girls and 15% of boys aged 10 to 18 were found to be at risk for an eating disorder. There were huge increases of eating disorders during the pandemic and since the pandemic. And then we also know that early intervention is the best predictor of success in treatment for an eating disorder.
Okay, the types of eating disorders are anorexia nervosa, bulimia nervosa, binge eating disorder, what we call ARFID, which is also avoidant restrictive food intake disorder that has some subtypes to it. Orthorexia is not an eating disorder that can actually be diagnosed in the DSM, but it more characterizes a way of eating where someone believes they are eating it in a very healthy manner, but the characterization is that it disrupts their daily lives in some way. And then just general disordered eating exists as well. Common warning signs and symptoms of eating disorders. So on the emotional behavioral side, we see a preoccupation with weight loss, preoccupation with dieting, needing to have control over food or control over their body in some way. Food rituals. There are many different kinds of food rituals, but something we may see is eating after a certain time, not eating after a certain time, eating a certain number of times throughout the day, or it can be the way that food is eaten, like in a particular manner, if that makes sense. We also see social withdrawal, so not going out with friends, not attending social events that maybe were previously important to the individual. Body checking, this can be looking in the mirror. This can be pinching certain parts of their body. This can be comparing bodies with someone else. And then very extreme mood swings. On the physical side, we see noticeable weight fluctuations that can be weight loss or weight gain. GI complaints, nausea, diarrhea, vomiting, dizziness upon standing, difficulty concentrating, sleeping issues, and then also issues with dental, skin, hair and nail health, and then an impaired immune system. The health consequences include the cardiovascular system. So in that system, we see muscle loss, low or irregular heartbeat. The GI system, or the gastrointestinal system, we see bloating, nausea, constipation, also diarrhea. In the neurological system, we see difficulty concentrating, sleep apnea, possibly a numbing in the extremities. In the endocrine system, we see hormonal changes, particularly with estrogen, testosterone, and thyroid hormones. For athletes, there can be lifelong damage to the heart and bones due to something we call REDS, or relative energy deficiency in sport. Some co-occurring conditions. Many people who are struggling with eating disorders also have what we call co-occurring conditions. These can be things like anxiety, depression, substance abuse, obsessive compulsive disorder, post-traumatic stress disorder, and up to 50% of the individuals with eating disorders abuse alcohol or drugs at a rate 5 times higher than the general population.
So it's true that eating disorders are incredibly common and pretty normal, but they don't have a look. They can affect anybody. It's really hard to, it's actually impossible to look at somebody and know if they have an eating disorder. We hear that a lot in doctors' offices where they, say, well, they don't look like they have an eating disorder. So I'm sure they're fine, but they can really affect anybody. And they're extremely debilitating. And it's important to know that they're no one's fault. They're not a family's fault. They're not the person's fault. It's not a choice. So those are some truths about eating disorders. So something we like to talk about is weight stigma. NADA, which is the National Eating Disorder Association, defines weight stigma as discrimination or stereotyping based on a person's weight. It's also known as weight bias, weight-based discrimination, fat phobia, and fat stigma. And weight discrimination is more prevalent than gender or age discrimination. And it's a symptom of diet culture, which is something we'll also talk about. So weight stigma can look like a lot of things, like being bullied at school for your size, excessive staring in public, consistent comments on your weight by friends, family, or colleagues, feeling intense pressure to lose weight, comments or judgments about what's on your plate, doctors not listening to your symptoms and only prescribing weight loss as a solution to health concerns, not receiving equal pay, not being hired or being passed up for promotions, not seeing models, actors or actresses or influencers in all sizes, and assumptions about a person's food intake or activity level based on the size of their body. So we see weight stigma everywhere in our society, but it can really affect the way people in larger bodies move through their day, and especially receiving or like being open to things like medical help and doctors. So we see the consequences for people in larger bodies. So diet culture is a system of beliefs that equates thinness and weight loss with increased health or value and moral virtue. Diet culture tells us that the more you fit into the cultural ideal of what a body should look like, the more your cultural value will increase. And this is harmful because this belief system tells us that our body size and appearance is largely within our control. And it also tells us that our value is linked to our physical appearance. And both of these are false and incredibly harmful. There are so many different things that affect our body size and our overall health. Things like our socioeconomic status, genetics, education, trauma, diet history, food insecurity, relationships, and stress are just a few of the other factors that affect our body size. So we like to think of like all the things that affect our body as a pie, and diet and exercise are two slices of the pie, but they're not the entire pie. There's so many other things that affect our body and our health. So the diet industry is just that. It's an industry. It's a 60 to $70 billion industry that's built on making you think that your value is determined by the way you look. The diet industry will encourage us to lose weight, demonize foods or whole food groups, and it doesn't guarantee this improved health or happiness or make us more valuable the way diet industry would lead us to believe. In fact, we have a lot of people who come to the eating disorder center who have, tried to lose weight and tried to, cut out all these food groups, and it just it keeps getting the goal keeps getting pushed back, and they're never finding that happiness that the diet culture told them they would find.
Okay, eating tips from an eating disorder dietitian. The first thing is to make sure you're eating enough each day. So this typically includes 3 meals plus snacks. Really consistent eating throughout the day is what our body needs, because our body thrives on fuel and food is fuel. If you start to feel tired or unfocused, consider eating a snack. So that's your body's way of telling you that it needs something, some sort of energy source. Make sure you're eating full fats and carbohydrates each day. This is probably counterintuitive to what you hear a lot, maybe on social media or even from your social circle. But our body relies on full fats, and carbohydrates are actually the preferred fuel of our body. So we need them in larger amounts than any other macronutrient. If you find yourself feeling hungry at night, consider eating earlier in the day and consistently throughout the day. So typically our days are very busy and we're going through them, and we get to nighttime and there may be an intense hunger. And a lot of times it's because it's the first time we've really sat down all day and are able to listen to what our body is telling us. So once again, that consistent eating throughout the day is really important. Listen to your body and eat when you are hungry or until you're feeling satisfied. So really listening to those hunger and fullness cues. If you've lost your hunger cues, know that your body needs food anyway. And the way to get those hunger cues to return is to eat something every 3 to 4 hours. And then you will notice that you're feeling hunger again eventually. Choose food you like and eat them until you are truly satisfied. Don't just stop eating because you think you should. If you feel the urge to stop eating before you are satisfied, you may ask yourself why. What outside source makes you feel this way? These are good questions to ask and perhaps to discuss with someone. Know that it is okay to eat sometimes because you are happy, sad, or bored, or just because it feels good. This is all normal. And remember that it is normal to sometimes eat more of something just because it tastes wonderful. And it is also normal to stop when you're satisfied because you know you can have more of it next time. It is normal to overeat at times and feel stuffed and uncomfortable. In fact, I believe we have a holiday next week that some of us may be participating in where we may do that. And it's normal to undereat at times too and wish that you'd had more. Don't feel guilty about these times, but take note and try to eat a satisfying amount next time. Guilt implies you've done something wrong, but food isn't a right or wrong thing. It's just nutrition. We always suggest eating when you're hungry, but there are times when you won't be able to eat just when you're hungry. When you have a class or a doctor's appointment, for example, a meeting at work, something like that. So try to anticipate those times and eat when you do have the time, even if you're not hungry yet. Trust that if you listen to your hunger cues and your cravings, you will get the nutrition you need. Our bodies are very, very smart and know exactly what we need. And we just need to be able to be really good at listening to our bodies. Remember that eating and planning your meals should take up some of your time and attention, but it should only be one area of your life, and you should have time to do other things that you enjoy and room to eat enjoyable foods as well. Healing from an eating disorder is absolutely possible.
And
Same.
yeah, that's
Oh,
what
sorry.
EDCMT does. We help people heal from their eating disorders. So we are a licensed healthcare facility located in Bozeman and Missoula. We treat ages 12 and over and all genders and all types of eating disorders. We offer an evidence-based and holistic approach to care. We treat not only the eating disorder behaviors, but also the root causes. Those things like the trauma and anxiety and depression that Brooke was talking about before. Our care options include outpatient, intensive outpatient, and partial hospitalization, which is a day treatment program. So we have some quotes from past patients. This journey is incredibly scary and difficult, but I know with the EDCMT staff, I will always be supported and cared for no matter what comes my way. So our team strives to empower our patients with newfound resiliency and skills they can use for the rest of their lives. Our team includes multidisciplinary clinicians. We have an attending physician or a psychiatrist on our team. We have advanced degree licensed therapists, advanced degree registered dietitians, nurse practitioner, registered nurses, and then we also have yoga, art, and music therapists on our team. Another quote from a patient, EDCMT truly saved my life. The combination of therapy, nutritional services, and group therapy provided direct support, accountability, and a community with which I could share my struggles and successes. I would not have grown into the healthy individual I am today without it.
Okay, our services, we guide our patients to address their stressors, moving beyond disordered coping to free them to live wholeheartedly. And this includes nutritional counseling and therapy, individual and family or family psychotherapy, group therapy, yoga, art, and musical therapy, medical and psychiatric supports. And then we provide lodging and accommodations to those who are from outside the Bozeman area. At EDCMT, I have a community of support, shoulders to cry on, and ears to listen to me when my mind is just spinning. I have hope poured into me through the smiles of my providers and other people ahead of me in the program. That's another quote by one of our patients.
So our programs, we place patients into a specific level of care based on the unique needs of each person. Our programs include outpatient, intensive outpatient, partial hospitalization or a day treatment, and then family support and education for parents of adolescents and outpatient programming. So our outpatient program treats ages 12 and up. Our programs are often viewed as a step down or step up approach. So it could be for those who have stepped down from a higher level of care or for those who are needing focused support to aid in eating problems and other mental health issues. Outpatient program includes weekly individual therapy, weekly nutrition counseling, and then for those patients ages 12 to 18, it also includes education and support for parents or caregivers. And then our intensive outpatient program, we treat ages 16 and up in this program, and it's for those who needs focused support or are in school or hold a full-time job. So it's 3 to 5 hours per day, 3 days per week. And it includes a meal with a registered dietitian and a group of other patients, and then group therapy sessions, individual therapy, weekly nutrition counseling, and other kinds of groups like music therapy, art therapy, meditation, things like that. And then our partial hospitalization or day treatment program. This is the highest level of care that's available for eating disorders in the state of Montana. We treat ages 16 and up. It's for those who need the highest level of care and consistent support. And I say the highest level because it's the highest level in the state of Montana. There are higher levels like 24-hour care that are available outside of the state. And we can help patients find those programs if they need them. But this partial hospitalization program includes 6 to 8 hours per day, 7 days a week. Sorry, it says 6 here, but it's actually 7 days per week. They do daily group therapy sessions, 2 dietitian supervised meals, 2 weekly individual therapy sessions, do nutrition counseling as well, individual. And then all those things like yoga therapy, art therapy, music therapy, meditation, cooking classes, nutrition education, all of those kinds of things. And we offer also daily medical supervision with our nurses and then weekly visits with the psychiatrist. And then we also have lodging that's available for out-of-town patients for those who are ages 18 and over. So we can help people from out of the state or out of the Bozeman area get that treatment. So we all do this together. All of our team members are trained for this, have a really big place in their heart for eating disorder treatment. And we're here for you. So another quote, I was convinced to my core I would never survive bulimia. I'm coming up on 1 year of no binging or purging, and it's been nothing short of a miracle. I look forward to my time with my therapist every week. I look forward to the safe place I have with them and the space they give me to heal.
Okay, the admissions process. So when someone decides to either inquire about our services or they've decided that they want to attend our programming, they will be, the phone will be answered by a friendly and welcoming team member. Most treatment centers have team members specifically designated to this role, as do we. The team member will answer questions and listen to the immediate concerns, and they also gather information and set up initial intake appointments with 2 of our care team members. The intake appointments include nutrition and therapeutic assessments. After the intake appointments, the staff will recommend a specific level of care based on the information they've gathered. And then the admissions assistant connects the patients and families with the next steps. And this will be based on the recommended level of care and then also answer any questions. So EDCMT, as AMA mentioned, has, we're located in 2 different locations in Montana, but we have 3 sites. And so we have 1 site in Bozeman, or sorry, 2 sites in Bozeman and then 1 in Missoula. And Amy, do you have anything to add?
Yeah, I just wanted to say maybe we could leave that last slide up for a little while if anyone wants to write down our phone number. This phone number here is our main line. That's the one you reach our admissions or just to ask any questions. You're welcome to give us a call. And then I do see that there are some great questions in the chat box. So we have one asking about a family member who's struggling with who they think is struggling with an eating disorder, but the family member refuses to acknowledge it. I think this is a great question. Everything, I don't know if I want to read it out loud because I don't want to share personal information, but for the recording, but everything you're saying does hint at an eating disorder to me. And I will say that, a lot of people have a misconception that older people don't have eating disorders, and it's something that only young, thin women deal with. But we do see a lot of older individuals coming to us, struggling with eating. And I don't know if you have anything to add, Brooke, but I guess I would just suggest sharing your concerns with them, and rather than like telling them like, oh, I think you should eat more, like sharing that you're actually concerned about them. You see these issues that they're struggling with, and you understand that they don't want to acknowledge it, but you see it, and you don't think that they should just let it continue. You think that or that there is help and support for them out there.
Yeah, I would just add like compassion goes a long way. So taking like that more empathetic approach versus a sympathetic approach to this is going to be really helpful, like really getting down in the weeds with them and letting them know that you just have so much love and care and concern for them is really helpful. The next question is, do you have aftercare or post-treatment relapse? Is that asking about specific programming, or are you asking if we see people relapse?
I would say, just to maybe answer that question, something about our program. So like I kind of mentioned, it's a step down program. So we often see patients in our highest level of care, and then they come down to one level less, the intensive outpatient program. And then they go to outpatient programming, where they're seeing their therapist and their dietitian usually once a week. And patients can stay in that level of care for sometimes years. So they'll continue to work with their dietitian, just make sure they're meeting all of their eating goals, and then continue to work with their therapist to make sure that they're addressing any urges that come up, or anything that they think might lead to relapsing. So patients can often work with us for a long time in that outpatient level of care, but we don't have any specific like aftercare programs, if that makes sense. Do you have anything to add, Brooke?
No, I was just confused about the question, but I think that you answered it. Now that I'm looking at it, that you answered it appropriately, that we have like the outpatient step down. So once patients are out of PHP and IOP, we're not just like sayonara or anything, but they then step down and are still working with their exact same team typically until it's appropriate for them to discharge. Yeah. We do use telehealth. We actually have our virtual IOP program is restarting soon. And then we also do outpatient appointments. We can do outpatient appointments through telehealth as well. Our dietary and our counseling, or our therapy appointments rather. If you're interested in working with EDCMT, making that initial phone call will help get that started.
Yeah. So at that initial phone call, you'll talk with our admissions coordinator, and she will ask some questions, get some information about like who your doctor is, who your insurance is through, all of those kinds of things. And then can kind of just chat with you, have that like kind of investigatory consult before scheduling a intake assessment with a therapist and a dietitian. The only caveat to that is that we do require a referral for a patient under the age of 18 from a primary care physician. And again, you can just call our main number, and Lori will walk you through all that, what you need from that primary care physician, and we have a form that we can send them. And then, Brooke, do you want to address the question about approaching a medical professional that gives
I can
about never eating between 3 meals?
I like to approach everything with curiosity in order to kind of understand where people are coming from. So I guess the way I would approach that would just to be really curious about that and say, why, if my body's telling me I'm hungry, why would you recommend I don't eat, like in between my 3 meals a day, and just be really curious to see where that individual is coming from. Yeah. Do you have anything to add to that, Amy, or do you have a better way to approach that?
No, I think that's That's a great thing to ask. And then just knowing that you're, holding firm in like your knowledge that you know your body best, and that when your body's telling you to eat, that's the right thing to do. And it can be disheartening when medical professionals push against that knowledge, but know that that you have your body's best interest in heart. And then, Brooke, do you want to talk about when are obesity drugs appropriate? I know this is so prevalent in the media right now.
This is a hot topic right now, and I'm going to be really honest and say that I am still doing a lot of my own research and also like waiting for a lot of the research to come out because it's still fairly new. I guess like I'm making an assumption there that we're talking about like Ozempic and Mounjaro and the likes, Mounjaro. But that really takes a team of people and a discussion to decide. So there's not like a fast and easy answer to that. One of the things I love about EDCMT is actually like our team approach to everything. So we would have an entire team working on that, right? We would have your PCP, your therapist, your dietitian, a psychiatrist, because it really is about like the whole picture, and you need a team of people to be able to puzzle together that whole picture to know like when obesity drugs are appropriate, if ever. I hope that answered your question.
These have been great questions. Are there any more? And I just want to say that,
Sorry, go ahead.
no, that's okay. I just want to say that we're always open to answering any questions that people have. You can again call that main number. And if Lori can't answer your question, she'll direct you to someone who can. So we're really happy to share as much as we can about this process. We know that seeking any kind of mental health treatment, but especially at a higher level of care, it can be really scary. So
there's one question I think we missed that I think is a really important one. And I don't know the answer to this, but does the state's insurance help with treatment at all?
Oh, that's a great question. Kim, maybe you can jump in, but just by state's insurance, do they mean Medicaid?
I think what they mean is the state of Montana benefit plan, which is where I'm through.
Right.
And if you have any questions about how that pays, the best place for you to go to is to Blue Cross and Blue Shield. They're our administrator for our medical plan, and they can walk you through how our plan will pay, how much they'll pay, that sort of thing.
Yeah, great question. And we've had a lot of success with Blue Cross Blue Shield treating patients. So that's one of the main ones that we accept. So yeah, but definitely checking in with the individual plan would be important.
And when I post this online, I will also put a note about how the state plan might pay for this. I will investigate it and put it on there because I should have done that before this presentation. As soon as I saw that question, I was like, oh, duh, of course I should have looked that up to see how the plan pays. So I will look that up and put it on the website as well, along with this presentation so that people know.
Amazing. Thank you, Kim.
I have a question too.
Yeah.
Kind of related to weight loss, because that's what I work with a lot of plan members on. People are highly, highly interested because like you said at the beginning of the presentation, we live in such a diet culture and there's such a pressure to fit a certain way of looking. And on the other side of that, there are also people that really are uncomfortable, like they hurt and they'd like to lose a little weight because of that. Or they have medical conditions where losing a little weight can be helpful for them. Like controlling blood sugar is a big one of those. So one question that I have is, if you guys could comment on when someone who's dieting or eating some sort of restricted diet for the purpose of weight loss, what are some danger signs for them that they may be crossing over into disordered eating?
Yeah, that's a really good question. I would say we don't ever advocate for any kind of restrictive eating, even for the purposes of weight loss. That's such a hard one. Let me gather my thoughts for a moment. I would say, this is what I will say. There are so many different body types that I think we don't recognize in our society, and not everyone is meant to be at necessarily a lower weight. So I can't speak specifically to people that like individual cases for diabetes or pain or anything like that. But what I would say, as from a perspective of my specialization, is that consistent eating and really following those hunger and fullness cues is going to be the best bet. And weights, and then of course, like movement in there would be appropriate. And that's going to be on an individual basis too, on what kind of movement would be recommended for individuals. And then your body is going to naturally go to whatever weight it wants to go at. And there's a lot more information on that. If people are interested in reading up more on that, I'm happy to send you some resources that they can look at around that. Does that answer your question?
Partially. I really love what you say about, really starting to learn to listen to their hunger and satiety, fullness cue.
Yeah.
And incorporating that physical activity and approaching it from that direction. I love that. But knowing that people aren't going to give up their weight loss journey, is there anything, because I guess maybe it would be helpful to tell you, like I work with people for health coaching, and sometimes I see those people where the way that they're approaching their food and even their weight loss itself is stalled because of some disordered eating behavior.
Oh yeah. Yeah.
So I'm wondering if you can maybe just, for those kinds of people, things that they, that they might be able to see in their own pattern of eating that you could speak to and maybe encourage them to review it.
Yeah. I see what you're saying. I'm understanding you a little bit more now. Yes. So signs that maybe like something may be concerning, I would say, would be ignoring hunger and kind of staving it off, which we see quite often. Anything that's disrupting like their daily lives, whether it be like socialization, or maybe they're very fatigued or have a lot of fogginess and they are having trouble concentrating. Any kind of physical symptoms like cold intolerance. So maybe in an ambient temperature, they're colder than their peers. Those are the top that come to my mind, but anything that's like really a disruption in their day, does that make sense? Like or in their lives in general, like they're not doing the same activities anymore, that they used to enjoy because of maybe their diet or their diet's like getting in the way, like the diet plan they're on or something like that. Does that make sense?
I think one thing I would add to that is maybe kind of trying to decentralize weight loss in this conversation rather than focusing on weight loss, like focusing on health, and just remembering that those two aren't synonymous. And one thing that we really focus on at ECMT is health at every size. And there are some, you can find it online. It's the Health at Every Size principles. And they really focus on joyful movement and really accepting that health doesn't have a size. And so from what I was kind of hearing, Kim, some of those things that your issues that your patients are working on could be addressed through other things rather than weight loss as the goal.
Yes, definitely. And that's very helpful. That's information that I feel like will be helpful to a lot of people who maybe, you know, are on the border of kind of disordered eating because of trying to lose weight.
Yeah. I just saw another great question. Says, can you share how I can be supportive of my daughter to help her eat, but without harping on her to eat, which seems to make the problem worse. Everything I do is wrong when I try to be supportive. I think this is something we hear from parents a lot. I don't know if you want to jump in, Brooke, as a parent and a dietitian, but know that this is something we hear a lot from parents that.
Yeah. I would say the first thing that seems to be helpful, depending on the age as well, is there's so many considerations here. So if the child is not eating at all, and it's like more coming from a place of worry that they're not getting enough nutrition, always our first step is to offer them what we call like their safe foods or their favorite foods. So foods that you know that they will eat, as a way to be supportive. We know that harping on them or consistently asking them to eat isn't helpful, but maybe asking them to sit at the table with you during meal times, asking them to help you with meal planning can be helpful. Maybe they're like getting them involved could be a helpful step. I, of course, am always going to recommend working with a dietitian because we are specifically trained in how to do these things. But if you can't get her to a dietitian, that of course is another thing. I do have a couple of resources that I will send in my email to Kim that might be able to help as well.
I would say too, if you can get her to do an intake with a dietitian or a therapist, I know a lot of patients will come to us and will think that they don't deserve help or they're not sick enough to need help, or that they've got it under control. And after talking with a professional, it can really help them realize how much they're struggling and how much their relationship with food and body could be affecting their day-to-day life. So it might be as simple as, hearing it from someone who's not their mom.
Yeah. And also I think there's like a level of fear too. And I think that can be overcome in the intake, like just the unknown of what it means to work with a dietitian and potentially a therapist can be like scary. But our intake specialists are really great at what they do. And I think they're able to really take those fears and help, help them see what getting help can really mean for them. And also doing an intake isn't, it's a resource. It's a way to get information. It's not necessarily, you're not committing to anything, I guess is kind of important to know as well. Cause I think people get scared about that too. Like, am I committing to doing this if I talk to someone? You're not, you're just getting information and giving information. I do see another question in here. Talk about issues in physical activity and eating disorders. Yeah.
Before, if I can interrupt real quick, I don't know, depending on the age of the child, how do you guys feel about Ellen Satter's division of responsibility?
I love Ellen Satter.
I was thinking about that as you were answering that previous question. I'm wondering if it might be helpful for this person.
That's actually the resource I was going to send is Ellen Satter. I love Ellen Satter's division of responsibility, and Ellen Satter has a website. I'll send you the information in the email, Kim, on her exactly what part I think is important. But she has something called the division of responsibility, and it basically is that the parents are responsible for a certain part of the meal. The kids are responsible for the other part of the meal, and the kids are responsible for how much they're eating. and kind of what they're eating. So you may set out several options. Let's talk about a dinner meal. You may set out several options for a dinner meal. And then the kiddos can choose what they will take from those options, how much of it they will take, and then mom and dad are choosing like the actual meal and then the times that the meal are offered. But yes, I love Ellen Satter, and that will be in my email. There's more to it than that, but that's kind of the basics of it. So physical activity and eating disorders. Yes. Sorry about that. Eating disorders, you know, as we saw in the first couple slides, there are several different types of eating disorders along with severity. And so physical activity is something that is discussed with the dietitian and potentially like the nurses, depending on what may be going on with them medically, and we determine it as a team. So someone who has a more severe eating disorder may not be recommended to have any physical activity because of the potential for injury. You know, side effects for eating disorders are like dizziness and fatigue and stuff like that. So falls are very prevalent. So physical activity, you know, typically in our higher level of program, we do not recommend anything above activities of daily living until they are able to nutritionally rehabilitate a little bit. And as they get stronger, we add in activity together as a team. But that's really after, you know, the symptoms are resolving. And then later on, movement is something that, like, when at the lower levels of care, particularly like outpatient, movement is something that is continued to be discussed as a team with the patient involved and what that looks like. Physical activity can be part of the eating disorder. So we see compulsive exercise as an example of something we see. And so we have to approach that in a way really taking into consideration patient safety, and then also working with them. It's usually a coping mechanism, right? So how can we replace that as a coping mechanism with other coping mechanisms, and then later come back to how to have a healthier relationship with physical activity? Anything you want to add to that, Amy?
No, I think you covered everything. Yeah. I wanted to make sure we talked about it as a eating disorder behavior, but
yeah. Yeah.
I have one thing to add if you guys have a space for it here.
Yeah.
I recently took a training called Mental Health First Aid. I don't know if you ladies are familiar with that or not. But it really kind of gives some good tools and resources for talking to people who have mental health issues, one of which can be an eating disorder, but it can also be things like anxiety and depression and those sorts of things. But I found that to be a really, really useful. It was like 6 hours or so, the one that I took, but I found it to be a really, really useful tool to kind of become aware of people around us, to be looking for signs and symptoms of a mental health issue and how to talk to them and what kind of resources there are. So I just wanted to throw that out for everyone too.
yeah, that's great. I hadn't heard of that one, but that's really interesting.
Those were really great questions. Thank you all for asking such great questions.
Yeah. Thank you so much for having us, Kim.
Oh my gosh, such a great presentation. So good to know about the resources available in Montana for this, and such great insight into a subject that affects so many people. So thank you both very much.